Here's a question for you. Do you need glasses? You know, as kids, glasses versus contacts can be a heated debate at home as kids shun their glasses and beg mom and dad for contacts. So what's a good age to really start wearing contacts? And are contacts more dangerous for kids than they are for adults? Dr. Kim Friedman is a member of the New Jersey Society of Optometric Physicians, and she joins us in the studio this morning with her daughter, Leanne. Nice to see both of you.
Thanks for having us back.
You know, first of all, how old do you have to be to have contacts? And is there really an age there?
Right. I really don't think there's some magic age where all of a sudden every child is ready for contacts. What we find is physically the eyes are ready for contacts really from infancy on up. So what it has to do with is more the maturity and the responsibility level of that individual child.
Of that person. Now, Leanne, you've had glasses and contacts. When did you get your contacts?
I got my contacts when I was about 9, but just in the past year or so I've been wearing them more often.
More often. 9 seems so young. Were you responsible with them?
Well, I didn't really wear them as much, so...
And now that you've got them in, how does it feel?
They feel pretty comfortable.
You're used to it every day. It's just like brushing your teeth. You just start in every day and do your eyes.
Yeah.
Yeah. Contacts also have become much more user-friendly. It used to be that there were just hard contacts and you had to take them out every day and you could only wear them for so many hours.
Right. Contacts have become much more user-friendly and the technology has improved to the point that we have much safer materials, and that's why I think it's expanded down to younger ages at this point.
So what are some things then we should be asking ourselves and our kids if they're looking at the debate over contacts or glasses?
Well, I think often it comes down to the parents' knowledge of the child in terms of their responsibility level. You need to know if your child is mature enough, and one of the ways you can check that is what's the condition of their glasses. If they're totally beat up, maybe they're not quite ready for contacts.
Yeah, right.
Also, does your child handle the responsibilities, their chores well, and do they need constant reminders to do things like brush their teeth or comb their hair or things like that? Maybe they're not ready. If they're doing those things on their own, maybe they are.
Maybe they are, yeah. Are there kids who are not good candidates? Is there anything that has to do with either them physically or with their eyes or you know, as you said, just mentally not ready yet?
Well, certain prescriptions may do better with glasses than contacts, but then the flip is also true. There are some that do better with contacts than glasses. In addition, anybody that's had previous eye surgeries or injuries or anyone that maybe just doesn't have the responsibility level yet.
Okay. So do you teach, you know, the big thing is when you go to the doctor, you have to really teach them how to put the contacts in and take the contacts out.
Right.
What are some things that parents need to know at home to make sure that those things are being followed if they're not contact wearers?
Right. Well, the good thing is there was just a study called the CLIP study, Contact Lens and Pediatric Study, and it showed that there was really no statistical difference between 8 to 12-year-olds and 13 to 17-year-olds in contacts, except that it took the 8 to 12-year-olds about 10 minutes longer to learn how to put them in and out. That was the only difference. So when we're doing the younger children, we make sure the parents are in the room too so that they're learning as well so that they can help if need be at home.
Okay. And you don't have any problems putting yours in and out, and if you do, mom's close by, right?
Yeah.
Yeah. She uses, you really, Leanne, you use yours for distance. You wouldn't want to get contacts if you're getting them for reading or something like that.
Generally, we wait till a child needs them on a more full-time basis, but sometimes we'll use them part-time for sports and things like that as well.
Well, that's the other question as far as sports goes, because can she wear them all the time, even with an active lifestyle?
Right. You can wear the soft contact lenses beautifully for sports, and in fact, it's a little safer than going with the glasses for something like that.
Very good. Dr. Kimberly Friedman, thanks for being here. We appreciate it. Leanne, thank you very much. Nice to see you as well. Cutie, off to schoolie, right?
Off to school. You got it.
All right.